Island leaders are speaking up for local dialysis patients. They are trying to bring resolution to the cancellation of emergency medical transportation service benefits by Noridian, the contracted handler for Region IX Medicaid. Governor Eddie Baza-Caval brought up the concern to U.S. Health and Human Services Region IX Director Herb Schultz during his recent stop in California.
All the problems started with this new contractor, Noridian, that is handling Medicare. We've also seen some legal opinions made by some of those firms that represent some of these companies that have been affected, and most importantly, the consumer.
As we reported, transportation services for dialysis patients on Medicaid are being denied despite meeting the criteria set forth by the program and receiving certification for transport.
We brought this to their attention, and we are looking towards a resolution. When Herb was advised of our position, he said he would get back to us. He wanted to look at his policy people and see what the issues were there and why there's been a change of interpretation.
The change in interpretation, according to Guam Medical Transport President Cliff Shoemake, now reads that patients must be non-ambulatory and on a ventilator to qualify for services. This leaves a vast majority of dialysis patients who still need assistance now searching for a means of transportation to and from treatment. But why the change in interpretation? Committee Chair on Health, Senator Dennis Rodriguez, intends to find out.
I don't know, and I wouldn't, I don't want to think that way, but I just don't know. And so, we'll find out. We'll get to the bottom of why that company is in fact moving in this direction. And based on our preliminary reports that we're receiving, even from the local company here, this is something that shouldn't be done.
While the answer is unclear, Governor Caval says a concern was brought to light by Schultz.
They did bring up that there has been a fairly large increase in terms of the services being rendered in the billings for ambulance services. But I had to remind them that in years past, ambulance services were free of charge by our fire department.
With GFD now charging for services, this of course means an increase in ambulance billing to Medicaid.
We clarified some of the concerns they had in terms of why the increase in billings, and then of course now it's a matter of doing some due diligence and having their legal people look at some of the opinions that were made here in Guam.
One thing is certain, the administration and the legislature both agree that these services should be provided to patients. Reporting for Guam's News Network, I'm Jolene Toves.